So welcome everybody. We're so excited to have you all here for our second music therapy talks. As you guys know, those of you who've been here before, like John and Jay and all of our friends, we started doing this really as a result, or we really saw a need for people to understand a little bit more about why we collaborate with music therapists and why a lot of us that work at the UKC are music therapists. Because we could easily give away the ukuleles to the hospital and then just hope that the children would eventually utilize them properly and cross our fingers. But by collaborating with music therapists, we really ensure that the instruments get applied appropriately and that they don't end up in a closet somewhere with all the other donations that they get throughout the year. So the fact that we're having these music therapy talks is to gain a little bit of insight into the different worlds that music therapists can really live in terms of the different populations, and then give you an opportunity to ask any questions or anything that you don't really understand about the nature of the work. Because it is technically a new field. We've been around since, World War II technically, and it really gained a bigger boom in the 50s and 60s. So it is still, we still need to do a lot more advocacy and ongoing education about what it is that we do and why. Before we start with Marissa, we wanted to just go over some updates here. And I'm on the wrong page, so I'm gonna move that. This is Ollie, but that's not what we're talking about. We wanted to show you some of our numbers here. Okay. So as of 2020, August 2020, we've shipped 1,159 ukuleles, of which 552 have been Rockstar sponsored ukuleles. So that's 47% of all the ukuleles that we've sent out have been sponsored by you, the Rockstars here represented in this event. So we're extremely grateful for that. And Jay can speak to that a little bit as well if you want, Jay.
I guess I'm unmuted. Yeah, thank you everyone for coming and for your participation in the Rockstar program. We are just so pleased to give you these MT stories, music therapy stories, because I think that's what that's why we give the ukuleles is to help the children and to get to actually hear firsthand how that happens is a real treat. So thanks in advance.
Thank you, Jay. So just like we were saying here, about half of our donations this year have been from you guys. But that translates into 54 out of the 215 hospitals being sponsored by Rockstars. So the 215 are around the world, but about 200 of them are in the US. So we're still mostly a primarily US driven organization, and we are happy to be that way because music therapy is really, the US is really a leader in music therapy practice. So we'll always be very happy to have that. With that being said, I'm going to stop my share and allow Marissa to go ahead and share her screen.
Great. Hello, everybody. All right. Hi, everyone. My name is Marissa Ranella, and I work at Seattle Children's Hospital on the Psychiatry and Behavioral Medicine Unit, so PBMU for short. And I'm going to be talking about music therapy treatment on our unit and using the UKC ukuleles. So I have a dual role on the PBMU. I graduated from Seattle Pacific University and obtained my board certification, and I started working as a pediatric mental health specialist. So on the bottom of the slide, I started there for a year, and I was advocating to begin a unit-specific music therapy program during that year. I kind of knew that I wanted to start a program and expand our services. And so between my two roles, there's a lot of overlap, but as a pediatric mental health specialist, I started out providing emotion coaching, crisis interventions, and support to patients while they're trying to engage in safe coping skills. So our patients come to the psychiatric unit because they're being unsafe towards themselves or others due to their psychiatric illness. And usually they're here for a short amount of time, but I'll speak to that in the next slide. But as a music therapist, I'm able to provide skills-based music therapy treatment to support patients in engaging in new expressive coping skills. So we're very skills focused. They're here to just learn as much as they possibly can. And then we can send them on their way to their next step in their journey. And I work as a music therapist, like we mentioned before, 2 days a week. And patients get one group each day or both days, and sometimes have individual sessions as well. So for our scope of service for the psychiatric unit, we're really focused on crisis stabilization. And crisis stabilization means what ways of engaging with music would help this patient stay safe through a period of crisis. And so a crisis is where patients are being unsafe towards themselves or others, or they're having failure to thrive, that their depression is making them not able to eat or sleep or go to school and participate in life in general. We also focus, like I mentioned before, really on skill building. So we're really trying to help the patients learn different skills to help them with different coping mechanisms. So this would look like in music therapy, what skills or resources do the patient and their family need to be able to use music as a coping skill? And this could be helping them learn how to have access to pre-recorded music on the internet or through the devices that they already have, or how to have access to instruments in the community. And for our patients, the average stay has been about 5 to 10 days historically, and we're really crisis stabilization, that's mainly our main focus. But recently, we've been needing to have patients stay with us for longer, and upwards of 4 months, and sometimes even longer than that. And last winter, we created a psychiatric intensive care unit, and that intensive care unit was developed and started with music therapy from the ground up, from the very beginning. So because I had started as our unit music therapist in November, I was able to integrate music therapy programming into this new unit that we created. All right, so the first kiddo that I want to talk about is A, and the ukulele as a catalyst for songwriting. So A is 16 years old, queer, and was adopted at the time of their admission. They had quite a few diagnoses, including in utero drug exposure, major depressive disorder, disruptive mood dysregulation disorder, anxiety, ADHD, PTSD, past suicide attempts, and self-injurious behavior. And they were also experiencing a really intense period of grief. They lost their biological or their adoptive father that was a biological family member, and that was closely correlated to their admissions and needing to have support through that. So they were here for about 4 months, and they received treatment in the intensive care unit. So they started out music therapy treatment in group. They also had music therapy in the past, and they were an active dancer in their community's dance program. They enjoyed many different kinds of music and expressed great interest in learning the ukulele from day one. Whenever I saw them in group, they were like, I want to learn the ukulele. Can we play the ukulele today? It was just a really big focus for them. So their music therapy journey started in group, and they pretty much referred themselves. They were able to advocate for themselves and be like, I really want some one-on-one time to work on my ukulele skills and just to have more space, not in group, to talk about heavier things. Our group structure doesn't allow the patients to talk in detail about their trauma and their experience. And so having this ability to have the one-on-one sessions with me was really helpful for them, and their treatment team supported them a lot. So their treatment plan looked like we started with an individual music therapy assessment. And we started with skill building with the ukulele because that's where they wanted to start. And it also fell along with our unit's philosophy. So it was such a great way to build connection and build skills that they could actually use while they were in the hospital. They were able to earn some what we called incentive time. So if they were safe with themselves and others for a certain amount of time during the day, they would earn 30 minutes of playing the ukulele. We then began recreating their favorite music with the ukulele for self-expression. Then we moved into songwriting with the ukulele, and they were working through their trauma. And this was their trauma and grief related to losing their family member and other events in their past. And this whole process was very patient-centered and led, and we were able to begin that deeper trauma work due to them being here for such a long time. The ukulele skills that A gathered and worked on and focused on here really was a big catalyst for them being able to engage in another skill, which was songwriting, and processing their trauma in a way that usually our patients don't get to have that opportunity while they're here. And because we had just created this new unit, it was just such a special opportunity for this patient to be able to kind of dive into these things. An example of something that they engaged with is they wrote a few songs in the format of a letter to their adoptive father who passed away. And using the ukulele for this, it was very accessible. They could learn chords really easily, and they felt comfortable with the instrument so that they could create these songs. Upon their discharge, I was assessing, how they would meet criteria for receiving the UKC ukulele. And so we kind of have them stored away. And if we are working with a patient who expressed great interest in playing the ukulele, and also their financial situation would, kind of warrant them receiving a donation like this, then that's when we start thinking, should we gift this to them? And A definitely met this criteria, and they actually had asked me, how do I get a ukulele, because I don't have a great relationship with my legal guardians, and I really want one when I go to my residential placement. And so then I spoke with David, and he was like, actually, we have this resource. And so that kind of really opened a lot of doors for us, and it was just perfect for this situation. And so A transitioned to a long-term residential facility. So they were on our unit on the PBMU ICU, waiting for a residential treatment through the state, and which can take upwards of 6 months, even longer than that. So they were on the list and waiting, and we were just kind of preparing them to move to their next step in their journey. And on the day of their discharge, I put together the UKC ukulele and a little note or a little name tag and all the things they would need, a tuner, etc. And they were just thrilled. And it was such a good situation because, I mean, they're 16, so, and, going through a lot. So they really wanted that independence, and gifting them that ukulele saved them kind of a very rocky interaction with their parents of buying them something. Yeah. Does anybody have any questions about A's journey?
Jay, I think you have a question. Jay Lee?
Yeah, I do. Thanks. How do I unmute this thing? Yeah, you're referring to this patient as they, and is it one or two people?
Oh, one person.
Okay, that was kind of confusing for me. All right, thanks. So that's awesome. So the ukulele actually helped them to process their trauma better.
Yes. Yes,
Awesome.
it did.
All right,
Marissa,
thanks.
can you speak a little bit about, you mentioned them having to earn the time with the ukulele? Like for me as a therapist, I hate to hear that. I hate to feel that there's situations where the kid can't just receive the ukulele and run away with it and be happy. Like, can you explain why some kids in the inpatient unit have to earn time with things that they enjoy, and why you can't just gift anything you'd like to them?
Yeah, for this specific patient, they were in the ICU, which was structured with a very strict behavioral incentive program. And so they had to show safe behavior to receive preferred items and to be able to engage in preferred activities. And so when patients engage in self-harm or suicide attempts, it's all a way for them to communicate, but to also get certain kinds of attention. And so when they're safe, we want to reward them positively. And when they're not safe with themselves or others, then there's just an absence of that reward. And so to help kind of break that cycle, they were on that strict behavioral incentive program. And so they were able to use the ukulele in group and in individual sessions, but day-to-day practice while they were in inpatient, they had to earn that extra time. And it was really a way for them to learn, oh, like if I keep myself safe, if I keep others safe, then I can do this thing that I really enjoy. And it was definitely hard for me to work with the treatment teams and the psychiatrists and the mental health therapists of, what's the line, like you said, Marilyn, like, you just want this kid to have the ukulele and have fun and, it should be all good. But for our kids, breaking down all of the different things that they enjoy and using it in a strategic way is really helpful to keep them safe.
If I could just add just a tiny little bit, Marissa did a great job of describing that. I think that this potential tension between what we as creative arts therapists see as the benefits of art and music making has to be inset within the theoretical orientation and the culture of these places that we're working in. So we have this, you know, very sophisticated, world-renowned medical institution, and then within that, you've got this subset of a inpatient psychiatric unit where, you know, these are children that are going through some of the most difficult mental health struggles of anyone in our community. And so it feels like threading a needle sometimes to find how we can work these things in there. And I think Marissa has done a really great job of doing that, understanding what the kind of dominant theoretical approach of the setting, and then finding ways that music can align with what the unit is using as its construct for providing treatment. So.
I also think it's impressive and great that he chose the ukulele as his reward, because a lot of other kids say, oh, well, I'll get more video game time or more TV time, but this kid chose the ukulele. So that's great.
Yeah.
Does anybody have any more questions about this case before we move on to the other one? Great, we can move on.
All right, thanks everyone. Okay, so case study number 2 is going to be about Kay and the ukulele as an opportunity to try new things and build trust. And also for Kay, I will be using the pronouns they, just to be non-binary and inclusive. So, but this is just one patient. All right. So Kay is an 11-year-old queer Black patient placed in foster care system during admission. So upon their admission, they were also placed in foster care at the same time. Their diagnostic history, they had complex PTSD, ADHD, reactive attachment disorder, which I will be talking about more in detail in a couple of slides. And they showed aggressive behaviors, and they had experienced homelessness before in their life. Just like A, they were also receiving treatment in our intensive care unit. They were also on the unit for about 4 months and was eventually discharged to a long-term residential facility. They enjoyed hip hop, R&B, and gospel music. And they also expressed great interest in learning the ukulele and listening to music. Their initial referral was much like A's. They started in group and advocated for themselves while receiving group music therapy, and they also had great support from their treatment team. Their treatment plan started with an individual music therapy assessment, so going from group to individual. And we also started with skill building with the ukulele within the therapeutic relationship and peer relationships. So Kay had the opportunity to learn the ukulele in group with their peers and then also one-on-one with me. And because of their reactive attachment disorder, the way that they interact with people and form relationships is really important to their overall health and progress. And having interactions where they try new things suggested by me are really restorative to their insecure attachment, that when they had attachments with adults that they weren't able to trust in the end, and they weren't able to trust adults to support them or challenge them to be better at anything. And so having this interaction with me and the interactions with their peers was really, really restorative to them. And they were also able to engage in safe and healthy experiences with their peers versus falling into peer pressure or what we call colluding. And so a lot of patients, especially on our ICU, they would kind of get together and, cause trouble together and, try to leave the unit or become aggressive with each other or with staff. And this was a common problem. But having music and having ukulele skill building was such a positive experience so that they could learn, wow, like I can learn this skill with my friends and with my peers, and they like me and I'm included in this, and I don't have to do unsafe things to be included. So because of them using ukulele and getting more into music and just learning how music can be a container for self-expression and communication for them, meaning that during our sessions in group and individually, they were able to let their feelings out within the music. So whether we were playing a song on the ukulele or listening to a pre-recorded song and learning it on ukulele, they were able to have opportunities for healthy and safe self-expression and communication. They were also able to express a lot of their frustrations with their inpatient hospitalization experiences of just being stuck on our unit for so long, and also a lot of their experiences of racism throughout their life and being placed in the foster care system. So they had a lot to process, and having these ukulele skills and this time with the instrument and with music was really helpful for them. This was very patient-centered and led, and so especially like they wanted to play the ukulele. It's really accessible for them, and they were central into the treatment process. So like I mentioned, the ukulele lessons were a restorative opportunity for healthy relationship building. And they learned the ukulele as a safe and expressive coping skill and opening up to music as a safe place. And they met criteria for receiving a UKC ukulele because they were very interested in learning the ukulele, and they also were in the foster care system. And kids in the foster care system usually receive like a monthly allowance if they are being mentored through different nonprofit organizations where they have, there's one called CASA. And so their CASA gave them about $40 a month, but that was all they had. And so if they were to have, they were willing to use their allowance to buy a ukulele before they went to their residential treatment. But thankfully we had a resource for them where they didn't have to do that. As they were transitioning from our unit to their residential treatment facility, I was able to speak with their psychiatrist, and he was totally ecstatic that they were receiving a ukulele, and it was a opportunity for Kay to know that somebody that's going to be looking out for them is interested in the same things that they're interested in. And it was really helpful for them because they were feeling really anxious about going to a new place with a whole new treatment team. And, you know, their whole life was in our hands, and they had just been torn away from their family. And their new psychiatrist was really excited for them to have a ukulele and was totally on board with everything. So that was really, really cool way for them to cope with the transition. And they were gifted their ukulele on the day of discharge, had a name tag and everything, and their AMR transport was actually an hour and a half late. So our kids have to be transported by ambulance from our unit to their new placement, and they were an hour and a half late. So me, their psychiatrist, their inpatient psychiatrist, and their inpatient mental health therapist all hung out with them for an hour and a half, and they were able to show off their ukulele skills on their brand new ukulele to their treatment team and have a really positive experience, last experience with their treatment team. And it was really fun. It was really, really great. Yeah. Anybody have any questions about Kay's journey?
I think John has a question.
Yeah.
John, can you unmute, please? There you go.
How's that?
Yeah.
When you say group therapy, therapy, where did my concept of the program was that if they were going to get a ukulele, if they were going to have a uke, they were given a uke and they played that uke. But evidently there's some room full of ukuleles that come out and it can be played by anybody in the group therapy session. Explain how that happens.
Yeah, it's a good question. The UKC ukuleles are stored separately, and we have ukuleles that we use in group that we just clean, and they're not UKC ukuleles, they're just our hospital supply. We save the UKC ukuleles to give to individual patients as like a gift. And so only my patients on the psychiatric unit receive group therapy. The rest of the hospital, because their needs are mostly medical, their treatment is received individually. And so for David and our other music therapists, it would look like them bringing the patient a UKC ukulele early on so that they can use it. And then, but with my kids, I need to assess their interest in it first. And then as they discharge, we give them a ukulele, because if we gave them one while they were still here and they would go to group and tell all their peers, I got a free ukulele from the hospital and you didn't. And, you know, so we keep our resources very, very close to us, and we have a pretty lengthy assessment and evaluation process for that.
Thank you.
Okay.
I'm assuming that relates to the strict behavioral program that they're on, that it's about balancing the reward versus the behavior that they exhibit to earn said reward. And that obviously only applies to the psychiatric units of the hospital. The rest of the hospital doesn't follow those kinds of programs, right?
Correct.
Right. And I could just add a little bit here. Yeah, that the psychiatric and behavioral medicine unit they have just a really unique set of circumstances, and all of these things are really designed to protect the patients and keep them safe. So again, we're just trying to make these additional services and programs fit and align with that and make sure that that we're keeping everyone safe. The last thing we'd want to do is, you know, have everyone suddenly demanding that they all get ukuleles. And, you know, as you know, some people have a fleeting interest in music, and others, it really hits them and it becomes part of their life. And so what we're really trying to target is those ones that when it hits them and it's really going to change their life and transform their experience and really provide them with resources and skills that will really help them in their situation. Those are the ones that we're really trying to target. But I will just share super quickly, there have been a couple patients that we've been able to give Ukulele Kids Club ukuleles to that were in the medical units. And one that comes to mind is a young woman who was 13. She was from an Alaskan village. She is a Native American. And when I first met her, she said, "Oh, I play instruments. I play violin." And I said, "Oh, tell me more about that." And she said, "Well, once a year, this organization comes to our village, and for 2 weeks, they have instruments that we use, and then they leave." And I thought, oh, after I pulled the knife out of my chest, I thought, oh my goodness. So that's how she conceived of herself as being a musician, you know, with that little window of time. So I introduced her to ukulele, and she loved ukulele, and she played and really started getting good. It was clear that her violin skills were transferring to ukulele really easily. So she's one that got a UKC uke and got it earlier in the process before she discharged.
Yeah, I mean, some of these situations are just, for us that are not in the hospital and not hospitalized, are just so gut-wrenching to hear, like, $40 for the whole month and he wants to spend it on the ukulele. I mean, that says a lot. You know what I mean? So I love and I hate to hear those kinds of stories, because I hate thinking that there's kids out there that just can't get access to something so life-changing because they want it. But I mean, it's the world that we live in, and we can only do as much as we can. Anybody else have any questions? Daniel, did you want to say something? Anybody else? Well, thank you so much, everybody, for coming. You know, we like to keep these things short and sweet. Thank you for Marissa for explaining about your role in the hospital, and thank you for David for sharing about your role as well. And so we're super happy that you all could make it. Please stay in touch, stay safe, stay healthy, and keep making music, please. We all need it.
Thanks, everyone.
Thanks. Great job,
Bye.
Marissa.
Great job.
Thanks.
Yeah, thank you. And you too, David. Awesome.
Oh, thank you. Thank you all so much, UKC, and then all the donors. It's really makes a huge impact on these kids' lives. So thank you.
You're welcome.
Thank you. Have a good night.
Bye, guys.
Bye.
Bye-bye.
Strings attached, be part of our tree. Join the Ukulele Kids Club.